This is Essence of Medicine. Today we're going to be talking about medical ethics. I'm Amanda.
I'm Melissa.
And I'm Dr. Abbasi, and this has very much relevant to everyday activity in the medical field, but as well, as a patient, listen to this because this will have impact on your immediate medical care. You will encounter this in your lifetime, what we are going to talk about. We in medicine, we get really especially in the specialized disciplines to treat pathologies. As a matter of fact, often we see patient as a pathology. We don't see a person. We have to work on that to see the patient as an individual with a problem. We see just the problem, and we are good at fixing that. Like, imagine even few hundred years ago, even 100 years ago, many of the trivial diseases that are trivial today would be deadly. Today, you don't die of appendicitis. You don't die of a broken bone. You don't die if somebody stabbed you. Most of the time, you don't die of it. All of that, you would die even 100 years ago. So we are good on the technical side. But medicine is more about just the technical side. It's about dealing with a person, with a human being, and considering all the aspect of the contact, exposure, and we don't learn that a lot in medicine, especially we in the specialty. It is like you put bunch of people, bunch of robots to do a robot job very well, and take lots of other aspects of the treatment out of the education. Now, Alyssa, you went to PA school.
I did.
Tell me, what did you learn about the medical ethic in your PA school?
I'm actually kind of happy you brought that up because we saw a big change on medical ethics when we started to go to school, as we had a club that put forth effort to bring in medical ethics because we were a big evidence-based medicine school. So when it came to medical ethics, we took a big toll on seeing that from a holistic view of a person. They taught us the basics of the science and the biology and the medical, kind of what we had talked about. And then they learned how we can take that and effectively give that to a person that is, like we said, morally not treating everyone with the same textbook answer, being able to listen and adapt based on what they feel is best as well.
So in your practice, you summed it up that, it's a very broad, medical ethic is very broad. We won't be able to cover it today.
No.
I want to cover a very specific kind of medical ethic today, because it happened to me 3 times today. Today's clinic was the shortest. I had clinic 2 days ago, and I saw lots of patients, and we had lots. Every day I have a clinic, I see something like that. And the specific aspect of the medical ethic I want to address today is that a patient comes to you and opens up the conversation about all the things that other people, other doctors have done wrong to him. This is the specific, very specific question in the medical ethic, as everybody wants to be a hero, right? And so everybody wants to say, like the joke is that if you bring a contractor to your house, first thing he does is all the things that other contractor did wrong. That is, then you will be the hero. You will. But even more, sometimes a patient comes specifically looking for a fault, because realistically, we know medicine is statistic. Anybody who can save everybody is either a lawyer, a liar, or a magician, not a physician.
Right.
So, but even the best surgery that has 95% success rate has 5% not success rate. Now, what happens to that 5%? These are naturally unhappy patients, and it is in our nature to look for a fault. So those patients, they go from doctor to doctor, and they complain because they are not better. And then, and I get many of those patients. There's, as a matter of fact, there's not a day that I get handful of those patients who all the other surgeon and so on couldn't help them, and they are naturally looking for a fault. And every surgeon gets that. It doesn't matter where you are, where you practice, what your success rate is. The question is, the specific, what we are going to address today, how to deal with that situation. What is the ethical way and what's the unethical way to deal with that group of patients? Now, patient came to me today angry and telling that the other surgeon did a two-level A-lift, meaning open up the belly, going through the front. And right after the surgery, that is what patient is reporting to me, that he could walk before, he couldn't walk now. Everything was wrong. And that surgeon, everything that surgeon did wrong. And looking for me to affirm that everything that the other surgeon did was wrong. Now, you will, once you start, seeing the patient, you will automatically see that. And you want to be patient's hero. It's hard to resist the urge to say, oh yeah, that was wrong, that, and so on and so forth. And they sort of lead you to that as well. So let's forget about the medicine. Amanda, I want you have a very good human level interaction with lots of people. Let's get it to your friends and so on. And I know that you have lots of friends in your age group, and I know that from lots of things that you told me, and even though I wasn't interested at that time to listen to all the complaints and so on, that they fight each other, and then there's a friction, and then one blames the other. They come to you, and then they confine that to you, that what the other person did wrong. In that situation, let's forget about the medicine. What is it? What do you think? What's the right way and what's the wrong way? And one of your friends says all the things that another person did wrong. What's the right way and what's the wrong way? What do you think?
Well, you should always acknowledge the person who's hurt, acknowledge their feelings, and say, like, even if you don't want to necessarily say that your other friend was in the wrong, you could say, like, yeah, I can see that you're hurt by that, or I can see that that made you feel uncomfortable. You can phrase that in a way that's not putting the blame on the other person by saying, I have a friend named Yana and a friend named Anna, so I'm just going to use them. I'm just going to use them as examples to make it easier. I wouldn't, if Yana was mad at Anna, I wouldn't want to say, like, yeah,
by the way, they're sisters.
They're sisters, so it's okay to use them because they fight
all
like
the time.
sisters.
Which sisters don't?
Yeah. So if Yana was coming to me hurt by Anna, I would say, yeah, I can see why you're hurt. Instead of saying, I can see that Anna hurt you, because you don't want to put the blame on the other person, but you don't want to push away the hurt person's feelings.
Okay, you practically summarize the medical ethic there. Now, what would be wrong in this situation to do?
Like, yeah, F Anna, Anna's a B, like,
B word.
Yeah, Anna sucks, which I would not say about you.
Only when we edit it.
If you aggravate her in that, and Yana is angry already.
She gets angrier and angrier. You have to de-escalate the situation.
You're escalating. What is the mental status of Yana when Yana comes to you and says,
probably seeing red. She's like,
you take a bad situation and you're limiting everything else, and you're escalating that person, and you're making an angry person even angrier. And we know when you're angry, when you're stressed, your whole system doesn't really deal properly with any kind of problem.
Right.
So practically, in your few words, you summarize what the medical ethic should be.
Yeah.
Meaning that, Alyssa, what should I not do in a situation like that?
You should not place blame on other physicians, healthcare providers without understanding the whole story, or in general, you should not.
I wouldn't be able to understand their situation, because to be able to be decide what they decide, I have to see the patient back in the time, look at all the films, this happening every day in my clinic. That somebody comes to me. Now I have to go and back in time, like a year ago, like 6 months ago, put my head in the head of Dr. X here in town. What films did he look at?
Well, not
what
only that,
situation what was the exam, and so on.
Mhm.
Have the mental status of that person and the patient in that situation to allow myself a judgment, what they did was right or wrong.
plus you have different training, so certain things that you can do, other doctors can't necessarily do, so
Mhm.
maybe they didn't think that they were doing something wrong, they were just doing the best that they thought they could with their ability.
Yes, and I give them the benefit of doubt that for the information they had, for their ability in that time, they truly did the best they could do. But I don't even have to assume that. I just have to not allow myself to have the God complex, to believe that I know everything they knew,
Mhm.
and then
Yeah,
and that patients really want you to do that because they're angry.
I think this applies in real life too, because there's often times where I'm upset about anything and I will go to Amanda and I'll talk it out to be like, am I crazy or am I actually mad? And I look for justification
mhm,
to justify, like, do I have the right to be angry?
Mhm.
And so you kind of have this same situation where, the patients may have or do have the right to be angry,
Mhm.
but then we kind of have that issue of where does the anger lie? Does it,
Mhm.
where was the problem at? We talk a lot about managing patient expectations. And again, something as simple as them thinking they're going to get outcome A and them getting B, even
Mhm.
though B is as good as it could have been, they wanted A.
Yeah. Well,
That's a good point.
let's go to the point that to this patient today.
Mhm.
mhm.
Come to me, had a surgery about a year ago by another surgeon. They did that, and in patient's opinion, everything was done wrong. His symptoms are much worse after the surgery, and I look at the films, and sometimes things are not perfect. And again, it's a big word in the Bible, those that who haven't sinned throw the first stone. You can always find wrong, and you look at the films, you listen to the patient, and you can always find something wrong. But if you dive into that, it is not really as bad as a patient believe it is. That you look at the films, yes, these things are not perfect, but does that screw sticking out a millimeter or two, does it really causing patient symptom? You see that the patient is more complex than that. Now, let's go back to the same question. What is medically not ethical for me to do in a situation like that? What is truly, as a professional, things you do in your private life and so on? Yes, if you just excite Yana even more to be angry more with Anna, initially you may feel like you're a hero for Yana and so on, but at the end of the day, it's it just make you less of a good friend. If
Yeah.
you do incite more.
Well,
more-
along with even more consequences than
Yeah.
just like Anna being mad at me or Yana being mad at me. At the end of the day, like, I don't know what happened totally with Anna or totally with
Mhm.
Yana, but if I excite Yana, now she's probably gonna tell she's gonna tell Brittany and
Mhm.
Elena, like, Anna did this, and now basically Anna's reputation is ruined.
Yeah, well, at least temporarily,
Yeah.
until the truth has its own way to come out and so on. But on the professional level, this is actually, in my opinion, a negligent to make the patient even more angry. He's already angry. He's already, the tunnel vision about everything. And then I would go and tell them all the things the other surgeon did wrong. Is that the reason? Is that my job to?
No, and it doesn't accomplish any goals either,
Not for patient, and that's what it's about.
or
no?
for you.
I'm not, well,
Like,
it's
it's not
about the
gonna make-
patient.
Yeah,
It's about the patient. I think the ethical thing is in that situation, let's say, and that happens as well. We are human. We doctors are human, and I can tell you, every week, many people who are not happy with their care in this town, they cancel their appointment with other surgeon. They come to me. It happens every single day, many times. And they come to me. What do they come to me for? Are they coming to me for the legal advice? Are they coming to me for emotional support, or are they coming to me for me to help their medical problem? Now let's put the patient in the middle of this care.
Mhm.
What is it? What is my job to do for that patient? To help them to feel better. Now, let's say some surgeon, nobody's perfect, has done something even wrong. Now, does pointing to that is going to make the patient care any better?
No.
It's just going to, consolidate their anger, and like same with Yana and Anna, and that would be ethically irresponsible of me
Mhm.
to do that.
Mhm.
And the same way, that they come to me to take care of their medical problem. It's and so what I'm going to tell you what I do in a situation like that, and what's the better way to deal with that. And as you said, I acknowledge that they're angry, and I acknowledge that they're in pain, and I say, and I repeat that again and again. I understand you are in a difficult situation, but let me concentrate on how I can help you. Sometimes they go back and say, but he did wrong, right? But that was wrong. And so I'm saying, I don't know that the situation, I haven't seen at the pictures, and it would be really not ethically correct. I say that word, ethically correct of me to make a judgment on the situation that was very specific, but let me help you. Let me see how I can help you from here on. And then I concentrate on the medical situation. So what I'm getting at, if you go to a surgeon, literally, or a doctor, and the way they proliferate their care to you is saying how wrong other surgeons are, stand up and run. Because if that doctor has only one way to show you how good of a doctor he is by pointing how bad all the others are, you can hear how bad others are from your friends or from your lawyer and so on and so forth. Don't go to a doctor for emotional support in that regard, in the pointing. That sort of proves to you that doctor is not ethical.
Yeah, also, it's something that I say with my friends, that when someone is like a consistent negative speaker of other people, usually there's a reason for that, whether it's like maybe insecurity or they're feeling bad about themselves. They try and have other people feel bad about themselves, or have other people see those individuals that they're insecure over as worse than them. So you talk bad about them for that reason.
Yeah, and very good point. And Alyssa, you are young into medicine, but for a long time I didn't understand why I would lose my medical license if I get caught drunk driving. Care to patient and driving drunk, these are two different events. I mean, you don't lose your license to do these lots of jobs. You don't lose your license. But in medicine, if I get caught drunk, why do you think it is that we are at such a high standard?
You're just held to a higher level than the average person. And we talked a lot about power. And I think a lot of that has to do with, no matter what little letters you have besides your name, and you went to school and you got that title, and that holds that power, and that alone, it doesn't take a lot to convince most people. But when you put someone in power and then you say those same things, like you instantly, it means more. I trust you more. So when you're put in positions such as, breaking the law.
You're a person of trust. You're the person that patient comes and take all their clothes off and shows us everything. But we are the person who a mother give us their children, and we cut them open and put them back together. We are held on a different standards than most of people. Now, imagine that person of higher standard start the conversation about talking how wrong all the other doctors who are measured to the same standards are. I think that is practically a gauge. It should go to the
A red flag.
Yeah.
red
Yep.
flag and tell you about that. This person is not just talking about one another surgeon that thing.
Mhm.
He's not concentrating on your care. He's concentrating to appear better than the others by pointing all the wrongs on the others. And there are few the other red flags that you should look for. Like if somebody a surgeon get offensive if you tell them that you're seeking other opinions.
Mhm.
And they get offensive and no, then what are you doing? Defensive, yeah, defensive. And what are you doing then here with me?
Yeah.
What do you want from me? Or it's a doctor that has really difficulty telling you, I don't know,
Yeah.
because our knowledge is limited. So, but practically the behavior that we put on the table in our meeting with the patient, it should be patient-centered.
Correct.
Mhm.
And if it is not, if it's like, I get angry because you are looking for another patient, that patient is not in the center of attention.
Mhm.
I can't, if I start, telling you all my credentials and so on, that why I'm the greatest person, but I went to this and that, I'm a professor here and there. If it's about me proliferating about how important I am, patient is not in the center. If I'm talking about all the things that other people did wrong, patient is not in the center. And
Yeah.
anything that take the patient from the center of attention and put anything else, peripheral thing around that, should be considered unethical.
Yeah.
And should be a red flag. Now, it sometimes is though hard, but like sometimes you do want to be the best friend for Yana, and
Or I agree with what Yana is saying.
Yana saying, yeah, and and that sometimes is hard to
Mhm.
resist the urge to say, because maybe that person, them, maybe they did some bad talking about you. You may be in a different situation. Anna, you think you did you wrong. It's really hard in that situation to say that, let me concentrate on your care because we are human. So in this specific situation, sometimes it's hard to say not all the shit about that person because, you don't have to like people. But what do I do in that situation? I have to take my feeling out of it,
Mhm.
put the patient in the middle of the attention. What would help that patient?
Well, what do you guys do in a situation where you do agree with what the patient is saying? Like if the patient got it,
Good
like, let me
question.
give an example, like if a patient got a second opinion and the doctor wanted to do an unnecessary surgery.
Happens all the time, every week
So
in
what
this
do you
town.
do? What do you do in that situation?
And in that situation, I instead of saying why the other person is wrong, I lay my ground and say, for this reason and this reason and this reason, I recommend this. And the patient said, but that doctor said this and that. And it happens all the time. Patients are scheduled for surgery in this town
Mhm.
for things that, and instead of saying why they are wrong, and I lay my term about why I recommend what I'm recommending. And believe it or not, most of patients have totally, absolutely capacity to understand their problem. Some surgeons don't agree with that. Just recently I was talking to a younger surgeon, say, you can convince patient from everything. No, you have to just make the patient understand by using that. I use a lot that like for a disc, I compare to a tire of a car
Mhm.
and so on. You can use analogies, you can use basic understanding. And I totally disagree that we doctors, we can understand things and patient. That was 1960s and 70s kind of view on medicine,
Mhm.
that I'm the doctor, you're the patient. You are lucky if that I'm talking even to you. I should just schedule you for this and that. Thanks God, that is gone.
Yeah.
But some people still behave that way.
Oh, absolutely.
Yeah,
Mhm.
some doctors still behave that way. But so I disagree with lots of surgeons on their plan and so on because I have a different education. Surgery that's 8 hours for them is 1 hour for me. They lose a gallon of blood. I lose 200 cc of blood because we have different training. We have
Yeah.
different tools. Like I disagree that you should drive from here to Los Angeles. I think we should fly. But driving is not wrong.
Mhm.
If you don't have an airplane, that's the only way you do that. So you see that there?
Yeah.
I'm not going to concentrate why the method that other surgeons recommend are wrong, or why they had the complication they had. Again, this happens all the time. But I'm concentrating about, this is word by word what I say my patient. Let me help you from here on. Let's concentrate on the future and how I can help you. Now, but this is what the impact of this on you, if you are listening to that, is for a second, when you go to a doctor, if you have a similar situation, listen to how they react to you. Like you have what you mentioned, like you have a friend that all she does all the time complaining about other people and putting other people in a bad light.
Yeah.
Or you have another friend that try always to be positive about the whole environment. Now, what do you think what that friend will do when he's talking to other people about you? Very same,
positive,
very
yeah.
same. If they're talking negative about everybody, they're going to talk negative about you. That is their personality. So in a situation like that, that surgeon, that doctor talking more about themselves than about
Yeah.
anybody else.
I think you had pointed out when you said that you just basically present them with, your recommendation and why. I think that's a great point that we need to say, like a red flag is when your doctors start to try and sell you
Mhm.
or, convince you. Because I definitely had appointments where I felt like a car salesman that they, I wanted this or this sounded right to me, but for whatever reason, not everything's money motivated, but for whatever reason, I think medicine has turned a lot into a business.
Yeah.
And it's really easy for people to get taken away with, oh, well, if I do this or say this, or I convince them smile this way, then my numbers are going to go up. Everybody's going to be happy with me and I'm going to be successful.
Mhm.
That's a really good point, Alyssa, because
Yeah.
I've always felt like ethics are carried throughout different situations. So if you have kind of like a low ethics scale when it comes to talking about other people, you probably have a low ethics scale when it comes to other things. And you're willing to do maybe a little bit, like you said, something
Yeah.
non-ethical.
And you know what I think the most important for us doctor is to understand that we are human,
Mhm.
to understand our own biases. Like, I said, like even those biases goes both ways, negative and positive. I really have a difficulty to tell a patient I cannot help them. It's just hard for me. I want to, just bend backward, do impossible sometimes. But in those, so this is sound like a good thing, right? That I really want to, I cannot send a patient out without trying to help them. But sometimes good intention as well can result in bad results.
Yeah.
Because then you try to do things that are not realistic. So by knowing your biases, you build your biases in your decision-making process. Like, we have these protocols. We have these protocols that certain thing has to be done before we do surgery. So I sort of displace that decision-making process out of my biased brain. Like my scheduler will not schedule a patient if certain things are not done. Like one of our things is that very few people do that. One of our protocols is that I have to personally tell the patient, encourage them strongly to get a second opinion. If I don't check that I did that, my scheduler will not schedule the patient. So, and by saying that to the patient, I'd encourage them, and believe it or not, their trust goes even higher. And it's hard. At first, it's hard to do that. So telling the patient, but then they understand. They understand that I'm a human. This is my opinion based on the information I have. But I'm bringing them your humanity. That listen to another surgeon. I don't feel offended that you encourage them to do that. But knowing that that's a hard thing to do, you put protocols in place, you put instances in place that you take your own biases out of it. So
Sure.
this is was a very short actually conversation about medical ethic, but I think we should continue this conversation.
Yeah.
Because again, I cannot emphasize how important it is in your actual care, because you will meet those people. It does not have much impact if you meet them in a supermarket or grocery store. But if it goes around somebody who's going to cut you open, take a brain tumor out of your head, or your spinal, cut open your spine and spinal cord and expose it, it is at the same level. Do you want somebody who's drunk often and they get caught, do that surgery for you?
No,
You want
I
somebody
want
who-
reliable.
reliable, a good person. You want to have a higher ethical standard for to help you. And in the moment, you might be just angry, and that person appease your anger and so on. But in the long run, I think that's a recipe for losing.
Yeah.
Well, and this is just not in only medical field. I think you just emphasized that how important as well that is in our rest of our life.
I think
Yeah.
it's everywhere.
Go hand in
Yeah.
hand, yeah.
So
Well, next we are going to be talking about our protocols, our multidimensional protocols.
yeah, and we are going to have our all advanced practitioners here, and we are going to sit down and go over those protocols and talk about the joke in the medicine spine is that you bring a case to 5 spine surgeon, 1 case to 5 spine surgeon, and walk away with 7 opinions.
Yeah.
Now, one of the sad thing about the spine is that it's not as standardized as people think. As a matter of fact, they did a study that made me very sad. That what the care you get for your spine problem has the most indicator of what treatment you will get is who you meet first. If you meet an interventionalist, anesthesiologist, chiropractor, physical therapist, spine surgeon, and in spine surgeon, what kind of spine surgeon with what background you get, that determines more than anything else. You would think your pathology would determine that, but that's so wrong. And our protocols are exactly to get our biases out of it. So it has a connection to this meeting, but we'll talk about it in 2:30.
Yep.
Yep.
2:30.
Okay, well,
Thanks for watching, guys. Have a safe week. Have a safe day.
and this is